The following is a strategy to implement Voalte technology presented by Hannah Neal. What is Voalte? Voalte is a mobile health technology company. They provide a means of communication and collaboration between healthcare providers with the use of smartphones and software solutions. Voalte also integrates with EMRs and provides access to medical applications. 3 Voalte collaboration solutions are currently available. Voalte 1 is a smartphone device that is used by nurses. This phone allows the nurses to communicate with all members of the healthcare team. Alerts such as call bells, vital signs alarms, and ventilator alarms are also sent directly to the nurse. Voalte Me enables physicians both on and off campus to use their own devices to securely connect with Voalte users. Critical alerts such as lab values are also sent via Voalte. Voalte Messenger allows desk-based ancillary staff, such as pharmacists and secretaries, to exchange messages with nurses and doctors via text messages. In order to improve patient care, clinical staff satisfaction, and increase hospital revenue, Voalte smartphones should be integrated into all aspects of patient care. Voalte combines technology and support to meet integration needs before, during, and after implementation. Voalte phones lead to increased hospital revenue. $12 billion, or 1.93% of hospital revenue, was reported wasted annually, secondary to inefficient communication. Inefficient communication has led to decreased time providing care. Voalte phones will provide direct access to all members of the team, reducing the number of callbacks. Increased response times have also been noted since Voalte phones were implemented on some units. Some units reported at least 19% increase in response times. Alarm types are relayed via text, enabling the nurse to prioritize tasks. This eliminates the interruption of care and decreases errors. Hospital errors are noted to contribute to at least 400 deaths per year. Voalte provides a secure network for clinicians to communicate, avoiding potential HIPAA breaches and lawsuits. Reduction in overhead noise leads to increased patient satisfaction. Some care scores were noted to increase by 2.85% after the implementation of Voalte phones. According to Sloan, the iPhone Voalte system costs approximately $250,000 when implemented in an average hospital. Before implementing Voalte phone systems, budgets should be considered. Costs for equipment such as iPhone, battery packs, charging stations, and repair costs should be considered. Potential costs during the rollout process include IT support, clinician training, and integration costs with existing technology. When researching cost comparisons amongst similar devices, a personal telephone interview was conducted with J.B. Leeming on March 4, 2016. JB is an employee of Voalte and is involved with the implementation of the product and software in facilities across 5 southern states, including Louisiana. When asked about the cost of implementing Voalte versus other similar technology, he stated the following: specific pricing is highly customized, even when considering implementation in a single unit. Voalte is unique in that it offers 3 aspects: point of care, communication, alarm and alert management, and Voalte Me for physician use. While other companies such as Legacy and Borsia may offer similar devices and software, no other company incorporates all 3. The consolidation of the 3 in one single device is cost efficient. The next 2 slides contain Voalte smartphone reviews, in which Voalte conducted case studies after implementing their smartphones in 4 different hospitals. The first case study was conducted in Boulder Community Health. It is a 110-bed acute care and 25-bed regional trauma center. During the implementation, hospital IT worked with staff to integrate the smartphones with existing monitors. This study found that smartphones were more efficient than their previous method of communication, which were pagers and wireless phones. The smartphones allowed nurses the ability to know if pages were pertinent and needed to be addressed immediately. Overall, Boulder Community Health found that smartphones minimized interruptions in patient care and created a more efficient workflow. adjusting clinical workflow, creating communication protocols, and making sure alarms went to the correct person were time-consuming aspects of the implementation process. The next case study was conducted at Cedars-Sinai Medical Center. This medical center is a 958-bed hospital. It implemented Voalte 1 in order to provide a means of communication within a secure network for its nurses and physicians. The implementation improved provider communication amongst healthcare workers. Improved efficiency of communication due to direct phone access and eliminating callbacks was realized during the implementation. Cedars-Sinai is currently moving to expand the technology to other units, including pharmacy and respiratory therapy. The next case study was conducted at Sarasota Memorial Hospital Healthcare. It is an 806-bed acute care facility. Previous trials to enhance communication with voice badge solutions were unsuccessful. The study found that 78% less overhead pages after implementation. According to the study, use of the Voalte phone in the emergency care center aided in decreasing the intake process by 101 steps, thereby reducing process waste by 33%. Implementation has since improved coordination of patient care amongst providers and units. The final case study was conducted at Wake Med Health and Hospitals. It is a 919-bed private, non-for-profit health system. It previously used Nortel phones for communication. However, the cost to upkeep these phones amounted to around $90,000 annually. Voalte phones were chosen to test because of its ability to work within the existing wireless infrastructure as well as integrate with Epic EMR. The study found cost savings of approximately $47,000 or 89%, secondary to decreased needs for repair costs. After implementation, the study found that the IT tickets decreased to nearly zero. After identifying the problem and need, creating a budget, and creating support from stakeholders, integration of the Voalte phone can begin. Technical infrastructure should be identified by hospital IT and Voalte in order to best integrate the smartphones and software. The feasibility and scope of the project should also be considered. An implementation team should next be formed consisting of clinicians, IT staff, and ancillary staff to determine communication workflow. Interviews will be conducted to obtain feedback by future users of this technology. This team will also aid in bridging the gap between technology and the usability of the product, ensuring its optimal use. Next, a support strategy will be created to train staff and ensure a smooth transition. Instruction on the operation of the new software and technology is very important because its integration will essentially create a new workflow. Hospitals should invest in staff education to ensure best use of the smartphone. Lastly, the implementation team should come up with measurable outcomes in which to determine the success of the implementation. These outcomes should be customized to the area in which the technology is being deployed. Finally, integration barriers should be considered and an evaluation plan should be made. Funding, usability, and alarm fatigue are all considered potential barriers. Project funding should be considered first. If funds are determined to be scarce, implementation on one unit at a time may be considered. The usability of the technology should also be considered. Not everyone will be comfortable using technology. It shouldn't be assumed that because we live in a tech-savvy world that everyone is comfortable using smartphones. Adequate training and support should be provided before and after implementation. Lack of training can lead to those who are less tech-savvy to not use the technology. This may essentially undermine the overall investment. Implementation of one communication type at a time, such as text messaging and then an alert system, may help accommodate the transition. Alarm frequency and fatigue should also be considered as a potential barrier. Alarms should properly be managed by establishing guidelines. One investigation conducted at 2 teaching hospitals revealed that each time a clinician was interrupted while administering medication, the clinician made 12.1% more procedural errors and 12.7% more clinical errors according to Bridging the Gap. Placing delays on non-critical alarms to allow the alarm to recognize that it may be due to artifact versus a true alarm could help alleviate the frequency of alarms. Also, ensuring that ancillary staff know how to properly link the patient monitor to the correct caregiver is also a way to manage alarms. Finally, in order to determine the success of the software implementation, feedback from users should be collected and evaluated. By conducting end-user surveys, you can gather and review information that may impact your workflow efficiencies. The following slide contains the references used during this presentation. This concludes this presentation.